Meeting today. I just want to let you know that this meeting is being recorded and live streamed on TVW. This meeting is also recorded to be posted and shared on the State v. Blake ESV 5476 page. That recording is open to public disclosure. Please do not disclose any private or confidential information during this meeting. And with that, we'll move on to the next piece of the agenda.
I'll go ahead.
Okay.
So I think, did you go through you went through the disclaimer, so I think we're good there, right?
Yeah.
Okay. All right. Thank you. And before I forget, John Hayden, I think he bailed me out the other day as the giving testimony in the Law and Justice Committee by giving credit to Michelle, which I should have done in my opening remarks. Michelle, you've done a wonderful job this past year. I think John mentioned herding cats, but really pulling us all together and keeping us organized. And it has been a year. It's been 365 days since we first got together as a group, and just want to start off by rather throwing it at the end, mentioning it up front, minding my manners and giving credit to where credit's due. And Michelle, you've done a fantastic job, so thank you.
Thank you so much.
Absolutely. And also, just a welcome. For those of you I haven't met, my name is Michael Langer. I'm the Deputy Director with the Division of Behavioral Health and Recovery within the Healthcare Authority, and was asked to chair this group 365 days ago. And it's been my pleasure. It's been really, really important work, really intense work, really we got in there, we've mixed it up a bit to get where we are today. And I thank you all for leaning in. And for those of you that started with us last year, thanks for hanging on. I know others have had to transition out, and we welcome some new folks, which we'll do here again today, but really appreciate the contributions. And we'll get in, today is a lot about organization, kind of where we've come and where we're going. And so I won't go through a lot of that right now, but just know that as we sit here on December 5th of 2022, I really thank you for being here, and appreciate all that you've contributed. A notice did go out. I think this might be coming up later, but I'm going to say it right now. A notice did go out this morning. We don't have the final plan for you today. It was initially scheduled to be completed on the 1st of December. We will be submitting it on the 31st of December or before then. But most of you have had an opportunity to look at the what's pretty close to final draft and give you comments. So thank you for that during the month of November. With that, I want to go ahead and begin introducing our new members. And we will start with Christine Lynch. Christine, if you could take a moment to introduce yourself. I believe Teresa transitioned off and may have transitioned off because she came to work for us. Teresa Atkins from a treatment provider representative. And so we do have Christine Lynch, who has agreed to join us on SURSAC. So Christine, do you want to give a little background about yourself and what you hope to gain from participating in SURSAC?
Sure. Good morning, everybody. Thank you for the opportunity to serve. I'm happy to do so. I'm the executive director at Olalla Recovery Centers, but I also sit on the State Association for Addiction Professionals as well. So my lens will come from the statewide, not just from Olalla Recovery Centers. My background, I've been in the field for about 27 years now. I come with a different lens. I come with not just the addiction background side, but also from law enforcement side. I used to work at the Sheriff's Department, and I used to do electronic home monitoring. So I've got kind of a diverse background. Kind of fell into addiction by accident, but I'm happy to be here, and I've stayed for over 22 years. So I'm happy to do that, and look forward to being able to listen to the great work that this group has already put forth, and hopefully if there's anything I can lend some guidance to or suggestions, I'm happy to do so, and appreciate the opportunity. Thanks again.
Thank you, Christine. I really, really appreciate you being here today and for stepping up and joining us. Next, we have Chanel Wolf, who has some lived experience that she's bringing to the table, and we're thrilled to have her here. And I should say, when we put out the word that we had a couple, 3 vacancies, there's a lot of interest in participating. I don't know the number, Michelle, but I think it was something like 40 or 50 applications we had in for 3 spots. So it was pretty competitive. There was a lot of folks who wanted to sit in and join and be part of the conversation and kind of monitoring the plan as we go forward. So Chanel, thank you for putting your name in, and thank you for agreeing to participate. And if you take a moment to introduce yourself, that'd be awesome as well.
Thank you. My name's Chanel, and I'm really happy to be here. I am an adult who has a lived experience with substance abuse, and with that came some legal consequences during my use. I also, on the other side of the spectrum, I have worked as a substance abuse counselor, a peer counselor, and I currently work in a different role, but still providing outreach to the community that I live in. I'm really excited to be part of this. When I saw the thing put out, I automatically applied. It's something dear to my heart. So hopefully I can bring in the experience on both sides and help a little bit. And thank you guys for the opportunity.
Absolutely. Absolutely. We love the new voices coming in and appreciate you being here. The one thing we do ask is, dive right in. If you have questions, ask them. If you have thoughts, share them. We're pretty active that way. So thank you for being here. Next up, we have from outreach service provider sector, we've invited James Tillett. Tillett or Tillett? I'll let you let us know how to pronounce it.
Right? In Canada, it's Tillett. Here in the States, it's Tillett.
All right, awesome. Well, thank you, James, for being here. I really appreciate you coming on board. And why don't you go ahead and let us know who you are and what you hope to get from SURSAC as well.
So I'm James Tillett. I'm in Spokane County. I work for a local nonprofit that works with individuals in recovery, whether it's long-term illness, mental illness, or drug addiction. I've got a lot of experience with outreach services being provided. I'm very passionate about the work that I do because when I first came into recovery, this was the place that actually helped me out in my recovery. So I'm very passionate about what that organization does. I'm on this endemic planning committee for HIV, STD, and hepatitis C prevention. I'm on the Spokane County Peer Network Board, so there's a lot of outreach with that, trying to get different organizations onto the same page. So I'm really excited about this opportunity. I have a lot of lived experience to bring to the table, and I'm just honored to have this chance.
Thank you, James, for being here. And as folks will notice, we have be able to kind of replenish some of our numbers in Eastern Washington as well. So we're getting a little bit more geographic balance with the new members as well. So thank you all for being here. And we will go ahead, and I didn't go through the agenda at the beginning. Maybe I should have. Next up, we're going to have Tony Walton speak a bit about the 5476 bill, or the Blake bill.
Sorry,
progress.
Michael, I realized that we skipped over the roll call, actually. So we should, if we've got a bit of time to.
Yeah, well,
okay.
That's important too. So we're going to go through today with quite a bit of grace. And if we forgot something, we're going to come back and do it. So Michelle, why don't you lead us through roll call, and then we'll go ahead and go through the agenda. Thank you.
Okay, sure. Yeah, and I also just want to mention, we also have public comment today, but that's going to be closer to the end of the meeting. 3 minutes per person for about 20 minutes. All right, so we'll go ahead and start with the roll call. Michael Langer.
Present.
Amber Leaders. Senator, I know Senator Dingerag couldn't make it today. Senator Braun. Representative Davis. Representative Griffey.
Here.
Thank you. Good morning. Caleb Bantagreen.
Good morning.
Good morning. Don Julian Saucier.
Good morning.
Good morning. Chanel Wolf.
Present.
Morning, Alexi Orr. Amber Daniel.
Yes, I'm here.
Good morning, Brandy Flood.
He put hers in the chat. She's
Oh,
here.
that's right. Yeah, she's here. Stormy Howell.
Present.
Good morning, Chad Enright.
I'm here.
Morning, John Hayden.
And I'm here also.
Good morning, Sarah Melfi Klein.
Here.
Good morning, Sherry Candelario.
Present.
Good morning, James Tillett.
Present.
Christine Lynch.
Present.
Sarah Gillard.
Also in the chat.
Okay, great, thank you. And Tank isn't able to be here today. Malika Lamont.
Present.
Good morning, Addie Edwell.
Good morning.
Good morning, Kevin Ballard. Hunter McKim.
Present. Good morning.
Good morning, Kendall Simmons. Right, Rep Taylor.
Present.
Good morning, Representative Mossbrucker. All right, thank you.
Thanks, Michelle. And so, again, just to go over the agenda real quickly, we will have Tony Walton come on here shortly to talk about good works that have happened over the last year or so with 5476 investments. We'll also ask Michelle to do a little recap of the Law and Justice Committee. Several of you presented. Thank you for presenting. Thank you for being frank in your remarks and very articulate in the recommendations that came forward. I'll talk a little bit about the plan, which I've alluded to, and some of the subcommittee work that we're readjusting to. We'll also be given an opportunity to talk about some reflections and considerations moving forward. That's kind of a group process, I believe. And then we'll talk about SURSAC in 23, have some public comment, and then wrap up by, I think, 11:55 or noon here. Is that right? Is it?
We'll be done by 11.
Yeah, I think it'd be 11, not 11:55. We added an hour there somehow, but I don't think that's right. 10:55. Okay, so let's come back, and I want to go ahead and ask Tony to come on. He's put together a really nice PowerPoint of some of the investments from Blake, and wanted the committee to have an opportunity to see the progress that's been made. So, Tony, would you like to take it on? And Tony, I should say, Tony is our interim section manager over adult substance use disorder services. This is a new role for Tony in this last month, and so we'll welcome him in his new role, as well as the project manager over all things Blake. So, Tony.
Yeah, thanks so much, Michael. And I am presenting my screen, and thanks for the introduction as well. Prior to being acting adult substance use disorder section manager, I was the senior project manager overseeing implementation of 5476. So pretty much everything I've been doing for, it feels like 2 years, but I think it's actually probably closer to a year and a half. But I did want to just come today and just provide an update on the program investments that were included under 5476. And if you have any questions, if you can just hold them till the end, I'll get through all the content and we can kind of go through any of the specific pieces if there's any questions regarding the update. So this next slide might be a little bit of a recap for a lot of you, but just a reminder that engrossed Senate Bill 5476 was the legislative response to State versus Blake, a Supreme Court decision that came down in February 25th of 2021. And it had a substantial impact on the RCW 6954013 and other RCWs that pertain to possession of controlled substance. It ended in the de facto decriminalization across the state, and the legislature created a piece of legislation to respond to the State versus Blake decision, as well as create a number of new behavioral health programs and interventions to create intercept points for individuals who use drugs, as well as creating this SURSAC committee that a good portion of you are representing today. I wanted to cover some of the court system changes under 5476 before going into the program development. Just a reminder, the 5476 did add the word knowingly to the criminal possession laws, counterfeit, and legend drugs. That does sunset July 1st of 2023. I think we've alluded to that a couple of times through the SURSAC committee and the conversations around recommendations around possession of controlled substance. That was a big piece of this work because the current fix to State versus Blake in the Supreme Court decision does sunset this coming July 1st. So I'm assuming that the legislature will have to take some additional action this coming legislative session to prevent that from sunsetting and keep the legislation moving forward in some way. There's also a number of other changes to law enforcement, the way that law enforcement engages with individuals who use drugs, as well as recommendations for prosecuting attorneys to divert cases for assessment and treatment. And then also some basic law enforcement academy training that started back on July 1st of 2022. That might actually be an interesting future presentation, is having the program manager from CJTC come and talk about the implementation of the new training for the basic law enforcement academy and what exactly they're informing new cadets on in terms of substance use and opioid and overdose response. So a lot of that was probably redundant for some of you, and then hopefully these next program updates is new information and interesting and kind of give you a sense of the overall impact that 5476 has had on the state as a whole in terms of creating and enhancing new programs, specifically prioritizing individuals who do use drugs and are at risk of overdose. So this is just a summary of those programs, and I'll go through each one at a time. I included just a summary of the allocations and appropriations that were under 5476. I think it was somewhere around, including appropriations for Department of Commerce and the Administrative Office of the Courts, around $80 million was funded through the bill. These are the appropriations that the Washington State Healthcare Authority was responsible for, and just have it broken down in terms of how that funding was allocated out into the community. So you'll see Recovery Navigator Program and HOST both went through the Behavioral Health Administrative Service Organizations, or BHASOs, and then we did direct contracts for contingency management. Short-term housing vouchers was a combination of BHASOs and direct contracts. So that's why it's kind of overlapping those two categories or columns. We did procurement for peer-run services, MOUD in jails, and SUD Family Navigator. And then the legislature was specific about contracting with Walker in terms of developing recovery housing and residences consultation services. So the first program I'm going to kind of summarize is the Recovery Navigator program. I think a lot of you are familiar with this program. There's been a considerable amount of work over the last 18 months in developing uniform program standards, which were developed from the LEAD core principles, or Law Enforcement Assisted Diversion core principles, and then also working with the BHASOs in implementing the program. This is a LEAD program at heart, and the uniform program standards reflect that, but they also incorporate other direction that we receive from the legislature in terms of how to implement a program of this size across the state and ensure that there's coverage in every county of individuals that can do law enforcement referrals and as part of a pre-arrest diversion program, but also outreach into the community, into getting into the community and identifying and engaging with individuals and community-based partners and trying to create a referral pathway for individuals who use drugs who have had a reduced quality of life as a result of that use. After the referral and outreach piece, it is long-term intensive case management through a harm reduction lens and intended to 100% support the individual with whatever needs that they have. I think that's been a big thing that we've noticed with the Recovery Navigator program is the flexibility to really address those different components of someone's life that might be preventing them from finding recovery and how they interpret that. But really being able to kind of walk with them along that path with a focus on hiring staff with lived experience, not necessarily clinical, not necessarily clinicians, but instead just peer workers that can really support somebody as they're accessing services, and whether that's behavioral health treatments or just social services in general. The next slides just cover some of the contractors that we have for the Recovery Navigator program, broken down by region. And I'll send a PDF of these slides to Michelle, and she can share with the group or post on the website. I'm not going to go through each one just for the sake of time, but just kind of pause there for a second so you can kind of get a sense of where the work is happening. I will note that the contractors is a combination of behavioral health agencies or community-based organizations. You'll see some recovery phase in there, Pure Washington. Really, there was flexibility in terms of allowing the BHASOs almost, and I think in the program standards, a recommendation or an urge for the BHASOs to work with non-traditional community partners. Focusing again on that fact that these aren't clinicians in the field doing the work, but instead individuals with lived experience that have that experience they can bring to the work. Next program is HOST, or Homeless Outreach Stabilization Transition Program. This program is expansion of a model that was created by the Downtown Emergency Services Center, or DESC, in Seattle, Washington. And the legislature provided funding and direction to expand that model. And you'll see on the map which locations it was expanded to: Snohomish, King, Pierce, Thurston, Clark, and Spokane. Our program manager for this is Maida Hogan, who has a long history of working in outreach and homeless response. And Maida has really helped support these areas in terms of expanding access to the host team, which is a team of multidisciplinary individuals, providing outreach into the community and accessing and engaging with individuals at risk of homelessness or who are experiencing homelessness, and providing street-based medicine and care and immediate engagement, really engaging with individuals who have historically not been able to access healthcare and behavioral health services through the traditional system and the traditional pathways, and instead meeting them where they're physically and literally at, and engaging with that immediate wound care and immediate physical needs, and then also prescriber services, mental health and substance use disorder engagement, and then also in providing harm reduction and survival supplies. We were able to use a little bit of funding that we had from the first year to purchase naloxone, and a lot of that naloxone went to the host team so that they had that naloxone to distribute to those individuals they were engaging. Here's the contractors for the host program, and you'll see we have Evergreen Recovery, Evergreen Treatment, Greater Lakes, Lifeline, Frontier Behavioral Health, and then Olympic Health and Recovery Services in partnership with Providence. Oh, I will note that these counties were selected based on the point in time counts from 2020. So we worked with the Department of Commerce to identify the areas or regions that had the greatest prevalence of homeless individuals based on those data collected during the point in time count. The next program that we'll cover today is medications for opioid use disorder in city, county, and tribal jails. Or MOUD in city, county, tribal jails. And this is just a list, a numbered list with where the jails are located that we are currently contracting with. 19 different jails across the state, which is amazing. The Healthcare Authority received $10 million for the biennium, $5 million in 5476 and $5 million as part of the supplemental the biennial operating budget. And with that money, either implementing expanding or enhancing MOUD programs, the full continuum of services for MOUD programs in city, county, and one tribal jail. This is just kind of a quick summary of some of the services provided, everything from screening to case management, reentry, ongoing engagement with the individuals, and really just ensuring that the jail has the resources that they need to ensure induction onto an MOUD medication, and also focusing on reentry back into the community to maintain that continuity of care. And here's the different contractors. I will note that we contracted with WASPC, or Washington State Association of Sheriffs and Police Chiefs, for 3 jails. And so that has been great to be able to work with WASPC, and they have the resources and the knowledge in order to kind of better support those smaller county jails in Stevens, Ferry, and Island counties. Some of the other contracts are directly with the jail or the government organization themselves, or we're contracting with Valley Cities and Pierce County Alliance and some behavioral health agencies that are able to go into the jail and provide the services. So having that kind of contract flexibility seems to have been a benefit in terms of best meeting the needs of the jail. Because, for example, if the jail is smaller, it might not have the administrative staff and support and capability to meet some of the data collection and reporting requirements and invoicing and stuff like that. So the behavioral health agency is then able to kind of step in and ensure that those kind of contractual requirements are being met while also supporting the provision of behavioral health and MOUD services in the jail. Oh, I will note UW ADAI is providing technical assistance for the MOUD in Jails program. And DESC, just to backtrack, for the host program, technical assistance training is provided through a contract with DESC. And Recovery Navigator program, we've been working with the lead National Support Bureau through the Public Defenders Association for technical assistance and training for those sites. And that has been a continuation of relationship since 2019 with lead expansion, working with the National Support Bureau to provide technical assistance to the lead expansion sites as well. Moving on, the clubhouse and peer-run organizations. Through the funding in fiscal year 22 and fiscal year 23, able to have worked with 21 different providers for expansion, enhancement, or implementation of a peer-run organization, such as a recovery cafe or recovery community organization. This was another kind of bifurcated funding where we received some funding in 5092 and then some funding in 5476. We decided to, because 5476 was so focused on individuals who use drugs or have a substance use disorder, we used that pot of that pot of money for specifically peer-run organizations, whereas the other pot of money went to Clubhouse, which is based off of Clubhouse International, which has a more focus on individuals with mental health disorder or have serious SMI or SED. So for the 5476 funding, it is focused on the peer-run organizations. And as you can see on the maps, we've expanded to 21 providers through fiscal year 22 and fiscal year 23. And so this is just basically a location of where all those are. I will note that every region in terms of BHASO region did receive funding, although they are direct contracts with the providers in that area, but we tried to ensure that there was statewide coverage with that funding. This is kind of fun. Lauren Robbins, our program manager for Clubhouse and Peer Run organizations, put this together, and I thought it was really cool. Just a great representation of how this funding was helped create new access points, new community-based access points for individuals who might be at early stages in their recovery or individuals who are currently still using drugs who need additional supportive services. And you'll just kind of see here some of the examples of new sites that opened up with that funding. You know, we have Kelso, Wenatchee, Aberdeen, Skamania, Klickitat, Maryville, really just all over the state. So it's just been wonderful to see that. And on our website, there's contact information for all the program managers. So don't hesitate to, look them up and, reach out to them if you have any specific questions. And I just wanted to kind of summarize the breadth of services provided by a peer-run organization. I mean, really anything you can kind of think of in terms of, I love the glass etching class, like, those sort of crafts and hobbies and kind of helping somebody find something that can keep them engaged and help kind of engaging with others. But also like access to computers, a lot of things that we all kind of take for granted, but are really meaningful for somebody whose life is in chaos and they have a decreased quality of life because of their substance use. And so having an access point for that, a non-judgmental access point where they can engage with peers, recovery coaches, other individuals with lived experience, it's just so great to see that expand across the state. And here's some of the where the funding went specifically. The map was kind of in general in terms, but these are a breakdown of the contracting agency, the model that they're using, and the county that they're operating out of. Okay, moving on. Michelle, how am I doing with time?
I think you're doing great with time, Tony. You have until 9:50 on the agenda, so
Oh, wonderful.
yeah.
It's funny. The last couple of times I've done this, I've been kind of rushed, so it's nice to actually have the time to kind of provide some additional context and background information. The SUD Family Navigator contracts. This is another funding that was both in the 5092 biannual operating budget and 5476. The table on the right is a summary of all the locations where SUD Family Navigators have been hired and are currently operating. And the SUD Family Navigator, at its heart, is basically the navigator for friends or family of the individual who is using drugs or who has a substance use disorder. So, really an innovative kind of intervention in terms of, supporting not only the individual themselves, but their support system, supporting the support system, and ensuring that, if you have a brother, a friend, a mother, a daughter, who is experiencing a substance use disorder, that you have somewhere to go to kind of understand the system and understand kind of what, oh, is there a typo here? Sorry, I shouldn't look at the chat. It just kind of throws me off. All right, I'm gonna put away the chat because I get in my So now I have to start all over. So support system for the a support for the support system, and so just really being able to help friends and family of individuals with SUD understand what that person's going through. A lot of education in terms of letting them know, like, hey, this isn't a moral failing. This isn't this is a medical diagnosis. This is something that that they're not, if they've wronged you or there's been harm in your life because of this, like there's a reason behind that, and really just trying to kind of help them understand, what it means to have a substance use disorder, and also what services are out there for their friend or family member. The short-term housing vouchers. That funding seemed to go really fast. I think it's been a conversation in the subcommittees and just kind of ongoing conversation in general. People need a place to stay. People need a safe place to stay, a reliable place to stay. And the short-term housing vouchers at least give somebody a roof over their head while trying to find permanent housing. And so we were able to use the funding that we received through 5476 and ensure that that the HARPS program, Housing and Recovery Through Peer Services, had funding for people who are using drugs or who have a substance use disorder, and ensure that that they can have a short-term housing, whether it's motel or other temporary housing, while they're waiting to get into residential treatment, while they're waiting to kind of apply to different apartment complexes and or other short-term or permanent long-term housing options. And so we put the out through the HARPS contractors, which you'll see here on the chart. It's a combination of BHASOs or direct services based on the region. And we're even able to give to reallocate money and provide additional funding for some of the short-term housing vouchers. And I think this is the last one before we talk about the SURSA committee, which, you know, everyone's probably really familiar about, so we might be able to just kind of skip over that, or I'll just kind of touch on some of it. But there was funding for Recovery Residences Technical Assistance Contract. And so 5476 did provide funding and direct HCA to contract with an organization with expertise in supporting efforts to increase access to and improve the quality of recovery housing and recovery residences. I included a copy of basically the deliverables that have come out of that funding. There's a grievance process, a new process and document summarizing that, a marketing plan to try to increase the availability of recovery residences, a private landlord toolkit for private landlords that are interested in, already have a recovery residence or are interested in starting a recovery residence, and then a community-based health association. No, CBHA, community-based, yeah, I guess that's it, community-based health association. I don't know why that sounds so funny. Oh, agency, community-based health agency, that's why. Okay, anyway, a toolkit for the CBHAs to understand how to engage with recovery residences in their community. So basically just kind of helping clarifying for the CBHAs what recovery residences do, as well as how to engage with them and how they can kind of how they can provide additional support for individuals that they're already engaging with as part of the CBHA work. No, there was one more. I was wrong. Opioid Treatment Networks Contingency Management. We received funding to implement or expand contingency management programming within the state opioid response opioid treatment networks, which also includes the SOAR funded hub and spokes. We received the funding in 5476 and then also in 5693, the supplemental operating budget. There was additional funding. It started off with a comprehensive technical assistance and training through Washington State University that went out to all of the SOAR, OTNs, and hub and spokes. Then there was some pilot sites. There's a great fact sheet on our website if you want more information about this. Laura Weed and Amy Dura from the Healthcare Authority have just both been really supportive of this and supporting the SOAR contractors in implementing a contingency management program. When I first heard about it, I was like, oh, this will be, this should be pretty easy. Like we're just, we're going to have the funding for the incentives, incentivize, urine drug screens that are negative. But there's a lot to it. It's a pretty comprehensive program in terms of doing it right and doing it with fidelity to the model. And what we ended up with were 6 sites that were able to really fully implement this with fidelity. And those are the ones listed in the table on here. So Northwest Integrated Health, Peninsula Community Health Services, Public Hospital District Number 1, Family Health Center, DESC again, and Grays Harbor County Public Hospital. So in those locations, there are fully operational contingency management programs that are currently addressing the co-occurring stimulant use disorder with individuals that have an opioid use disorder as well. 940. SURSA committee and plan. It's on the slides. Michelle will post the presentation to the website. This is a summary of basically what you all have been doing for the past year. I think exactly a year, right? Like the first time you all met was December 6th of 2021. December 5th of 2022. So just really kind of summarizing where we started back in September, October, November of last year with the sending out the requests for applications and the applications for committee involvement identifying and selecting that committee, and then all of the work that's happened in 2022 and putting those subcommittees together. It's just an incredible amount of work, and just a whole team of HCA and Department of Health individuals supporting that work. We do have the SURSA plan that was due on the 1st, a little bit of delay in submitting that. You know, it's a big plan. There's a lot of information there. And so I think we want to make sure we get it right, and we want to make sure that it's accurate and that it's been vetted and that the information that's included. So there, I think Michelle sent out an email earlier today that there is a little bit of a delay in submitting that, but as soon as it's available publicly, it'll definitely be shared broadly. And then there's just some requirements that by December 1st of 2023, rules and contracts will be entered into to implement any pieces of the plan that we're able to implement without additional funding or guidance from the legislature. On this slide, there's just some links for the, I think everyone probably has access to the website and webpage by now. For additional information, you can contact me, but there's also the HCA 5476 website. The contact information might change in the future as we try to get acting person in the senior project manager role. And with that, I think that's everything. So let me start with the chat. I saw some stuff going on in there. I of course, wow. Okay. Was that last side's peer couching? James, nice catch. No, I don't think peer couching. So I'll make that change. Appreciate that. Are the RNP programs at 20%? Okay, let me. Wow, there's a lot here. You know what? How about if anybody has any specific questions, why don't you unmute and ask, and then it might be easier than kind of me going through the chat because I don't even know where to start. And yes, I did. Well, I guess if I start at Amber Daniel, yeah, Amber Daniel has access to the chat. I thought that when she said somebody was available. So yeah, that's congratulations, Amber. I know that's been a big barrier. Caleb, go ahead.
Thanks, Tony. My question was around the Recovery Navigator program. I really appreciate seeing where it's happening and what providers are doing the work, but what I want to know is how much work is actually being done. The question came up in the work session last week, and there also were some comments around Recovery Navigator programs being nothing more than brochures. So I'm concerned that we're not being incredibly specific about the exact nature and amount of work that is being done. And I'm concerned that that will be used to say that this law isn't working. So can you say more about how much work is being done by those Recovery Navigator programs, and or how much that functioning is limited to the degree that they may not have the types of harm reduction community-centered programs that the law requires actually available? That is, the programs might be there, they might be staffed up, but their rate limiter is the capacity to actually refer them. Can you explain what's actually going on in terms of service delivery?
Yeah, great question, great point. And the sort of feedback, like it being nothing more than a brochure, like that sort of information is really helpful. If in the future, if anybody has any feedback or experiences like that, please let us know. Reach out to me or Michelle, and we can get you in touch with the Recovery Navigator program managers. But yeah, it is variable across the state. I mean, thinking about 39 different counties, all trying to implement a pre-arrest diversion program that includes elected officials, prosecuting attorneys, defense attorneys, all coming to agreement on which scenarios somebody can be eligible to be diverted from the criminal legal system in their county or city. It's not something that can happen in 18 months, 12 months. I mean, it is going to look different based on which region. I think some regions are a little further along in terms of actually having those agreements or MOUs in place, where if law enforcement comes across somebody who has potentially committed a theft 3, that they're going to contact the Recovery Navigator program and make a referral into those services as in lieu of citing or arresting and jailing. I think what might be helpful is maybe in the next meeting we have Suzanne Straw and Ryan Keith, who are kind of like our Recovery Navigator program duo, come in and do a more comprehensive summary of Recovery Navigator program. Because I think you're right. I think that a lot of people are looking to this being the solution to State versus Blake. It's basically, if we're not going to arrest and jail individuals who are possessing controlled substance so that they can access services through the criminal legal system, what other option is there? And I think the other option is, pre-arrest diversion, referral, outreach, and engaging with them at that 0 and 1 intercept points. But a year or a year and a half isn't enough time to fully implement those programs, collect enough data to demonstrate efficacy and impact. And so I think that, understanding how these programs are, the amount of impact that they're having in the community, it's going to require a little bit more time. But yeah, you're right. It is variable across the state. But I noticed Malika has her hand up, and Malika being the lead TA provider for Recovery Navigator program. And lead, that wasn't a pun. I meant like the primary TA provider for Recovery Navigator program might have something additional to add to that as well. Malika?
So I just wanted to, validate the feeling that it is not being it is not being rolled out uniformly across the state. And it was envisioned to be lead at heart, but we're far from the model in many communities across the state. It could be fixed. However, it's going to require, we have well-established framework, and the critics are correct, as Lisa said in the comment, because it's not built out as intended in many places. We're far from where we need to be, but we can fix it. But we need to dig in, and that's the collective capital WE, we, to do that. But people aren't wrong that it feels like there's nothing for police to refer to. And so I just wanted to validate that feeling.
Can I jump in there? This is Brandy from Reach. I just wanted to add, all their points were correct, but also people are not thinking about, we're not matching harm reduction services and treatment services at the same rate. And so if you don't have, we still don't have treatment in demand in Washington State. We still don't have drug user health at the level it needs to be. And so you also have to match those things well for these programs to work. So just like police feel like they don't have anybody to refer to, once you refer to the service, there's not robust treatment and health services to support those folks in the community to change their social situation. So housing, drug user health, gainful employment, legal employment. We need to also have those services at the level for Blake to work successfully as well.
In the SURSA plan, I think the SURSA plan is kind of creating some of those kind of ancillary services. But that point, Brandy, I think it is a full continuum of services, both the pre-arrest diversion option and the community-based outreach and referral, as well as ensuring that the individuals providing the intensive case management for those that are referred to Recovery Navigator program are really able to access the entirety of different things that somebody with a substance use disorder or are using substances would need. So that's a great point. Was there anything else in the chat that, sorry, there's just a lot there, so I don't want to, it'll take too long to go through it. Is there anything else anybody wanted to kind of mention, or any other questions before we wrap up? I think I'm at time.
Tony, this is Michael. I would just agree with your sentiment about maybe coming in and doing a more thorough overview of Recovery Navigator. It's my understanding that we do have staff hired in each county, including the outreach workers and case managers. So there, in fact, should be a place to refer people to, at least initially. We've had a lot of success stories coming in, really profound success stories of people whose lives have been changed and are impacted for the good as a result of the Recovery Navigator program. So while I concur there's a long way to go in certain areas and just even statewide, We still have a lot of growth to happen. Please don't be too dismayed that there's not anything happening, because there is. And we've gotten really nice stories back about how important and impactful it has been throughout the state in different places. So I think if we give a more thorough review, we can kind of give a status. It does change month to month. And I agree with Malika. We need to be working together to, continue to improve upon it as well. So thank you.
Sorry, Caleb and Julian have their hands up. I wasn't sure if that was about the presentation but Caleb, go ahead. I think your hand was up first.
Julian hasn't spoken yet. I'd like to have Julian go first, please.
Thank you.
I just want to add that I just want to see if we can get some of the stories, the success stories, to be able to talk about somewhere, some way, to be able to share those and understand those. That'd be great. And also, like all the articles that came out about they're just handing them a pamphlet. Like, what does this pamphlet have on it? Do we know what they're handing out?
Michelle,
the way it was shared at the hearing, Julian, was that the Recovery Navigator program was a pamphlet. That was the sum total of it. That was law enforcement's and prosecutors' experience of the Recovery Navigator program, was that it was nothing more than a pamphlet, and that was pretty disheartening to me. And just what I raised my hand about, and I'll be interested what Representative Davis has to say about this, is it's December, which the session is going to start. The work sessions have already started. Like, we need to be prepared to share this information last week with the legislature in a coherent, cohesive way that says, here's what we've done, here's how much it's been taken to scale or not, here's a cascade of care for the delivery of these care, here's where we're missing components, that's why we're stuck here, because we have nowhere to refer to. I think that needs to be told in a clear, visual, compelling way now. Otherwise, the legislature is going to assume the worst without the information, and they'll make their decisions based on that, in my experience. So I would really encourage us to take some concrete action on the communication side.
Thank you, Julian and Caleb. I just wanted to make sure that there was somebody kind of taking down some of these action items and suggestions. Okay, great. Thanks, Michelle. And yeah, I think Caleb mentioned Representative Davis had their hand up.
Thank you so much, Tony. I would be happy to clear up what I'm certain is the reference to a brochure. So folks may recall that the legislature had no warning that the Supreme Court intended to essentially get rid of our drug possession statute. And so we had a gap. So even though our grand plan to respond to sort of the Blake population includes all the investments that Tony did such a good job discussing, Recovery Navigator and Host and MOUD and jails, obviously all of those things took time, and the flagship response was the Recovery Navigator program, or a statewide expansion of the wildly effective, wildly popular, including popular with law enforcement lead model. That was the intention. When you're trying to move $45 million out and scale a program to 39 counties all at once, obviously that takes time. And so the bill had an emergency clause, right? It went into effect right away. So 2 seconds after it went into effect, I got on a call with our friends at the Public Defender Association, the lead TA provider, and was like, what the hell do we do for right now? Because we're not going to have a Recovery Navigator program in every region for quite a while for obvious reasons. You have to move money, you have to hire staff, you have to enter contracts, you have to train staff. And so then I called up my friends at the Washington Recovery Helpline, and I was like, yo, can we, do some kind of wallet card for law enforcement that has your number on it, so that at least between, now and when the Recovery Navigator program actually gets up and running, they at least have something. And so law enforcement in most jurisdictions believes that that wallet card, which is basically a card that says what the Recovery Helpline does and does not do, that is the totality of the legislature's response. And that, obviously is fairly laughable, right? It's a little wallet card. It was a stand-in, but that's what they think that it is. And they are largely unaware, until, things really, really get underway and these policy coordinating groups, get underway such that we have law enforcement engagement and prosecutorial engagement. Until such a time as we truly have lead statewide under the name Recovery Navigator Program, I think there's this broad perception that like we literally left all the cops hanging with a measly little wallet card. So I'm quite certain that that's what they're referring to. And it is going to take a tremendous amount of effort on all of our parts to educate not just law enforcement, but community, but also the legislature. Most of my colleagues also are not aware that we funded this Recovery Navigator program and that they're supposed to be lead in every jurisdiction. We pass, 1,500 bills a year or not 1,500 bills a year. There's 1,500 bills introduced. My point is people don't track this stuff. And so when their community tells them it's just like a piddly little wallet card, most of my colleagues believe them. And so not only is it important to get those success stories and understand where our RMP expansion is at for this committee, it's important for the legislature to understand that in any and every way that we can possibly help them understand that our response was more than a wallet card and that was merely a stopgap. Hopefully that clarifies where that comment came from, though I'm not sure who said it, but I'm certain that's what they were referring to.
Thank you. Yeah, and I remember that. I remember those initial conversations. So yeah, that's kind of ringing memory there in terms of that kind of stopgap. So thank you, Rep. Davis.
Tony, I know we need to move on. I would just add one other point too, is that our state is vast and large, and the counties are large, and they've got, big populations. And so while we are in every county, and we may be able to have some capacity to address the need in those all counties, there's still many parts of those counties that will not be touched immediately with the investment. It's a big investment, and it's one that we appreciate considerably, but we still are certainly not up to scale in every community, even with what we have. So there are going to be some differences depending on where one zip code and geography is at this point in time. So. Michelle, should we go ahead and move along then?
Sure. Yeah, I just wanted to give a quick update to the group about the Senate Law and Justice Committee meeting that happened last Thursday, December 1st. Several SURSAC members were invited to present on pieces of the plan and perspectives from their role in the committee. Michael began by presenting an overview of how the SURSAC was assembled and what the charge has been for this group, and touched on the committee's recommendation to decriminalize simple possession of controlled substances with no civil penalties or fines. John Hayden shared his perspective as a public defender on the consequences resulting from using the criminal legal system to respond to a public health issue, the substance use disorder. Chad Enright shared his perspective as a prosecutor on the SURSAC's recommendation to decriminalize simple possession. And then Amber Daniel provided an overview of the SURSAC approved recommendations that had originated in the Outreach, Engagement, and Diversion Subcommittee. Caleb provided an overview of the Treatment Subcommittee SURSAC approved recommendations as well, and emphasized how important it is to offer harm reduction and treatment options that people actually want, and that those services are low barrier. Sherry Candelario provided an overview of the recommendations coming from the Recovery Support Services Subcommittee, and everyone did a really fantastic job. It was great to meet some people in person finally. So just wanted to provide a recap of that event. So thanks to all that were there and all that were able to call in on Zoom and present.
Thank you, Michelle. And if you did not have an opportunity to watch the work session, I believe it's still out there where one can get a link and go look and take a look at the testimony that your fellow committee members provided. Because again, as I said at the beginning, I really appreciate the frankness of the conversation and of the recommendations. We are at 10 o'clock, which has us behind just a little bit, but I feel like we should take a moment here for those that had an opportunity to provide testimony. If you wanted to add anything to Michelle's recap, feel free to do that at this time. We'll take a few minutes and then we'll transition to the next item. Or just your experience. For some of you, I think it was your first time of getting to or have an opportunity to testify or to provide comment in that forum. So any thoughts you have about your experience that you wanted to share, you're welcome to as well.
And the link has been posted in the chat.
Okay.
Yeah.
Thank you. Well, perhaps one time was enough. So again, thank you all. And really, again, appreciate you sharing your words that have come forward from the committee itself. Let's see. Malika, looks like you might have a question.
Just curious why this wasn't shared with the larger group that you were going to be doing it. Because I went through my emails and I realized that I don't think that it was shared with us that you all were doing that.
I don't know, Michelle, did we send out the link beforehand or the notice beforehand? I don't recall, Malika.
It wasn't.
That's on me if we didn't.
Yeah, there were certain, the co-chairs of the subcommittees, as well as John Hayden and Chad Enright, were invited. It wasn't an HCA initiated event. It was something that those folks were invited to participate in. So, apologies in hindsight, we probably could have found the Zoom link for people to join who wanted to watch, but the recording is available now.
Oh, I mean, I'm just saying, it was all of our work. And if we're looking to have a more equitable and inclusive process, it would seem that it would be good to let all the people that contributed to the process know that the work was going to be discussed. That's all.
Oh.
Yeah. Thanks, Malika. We could certainly send that out in the future if we're called forward again. Again, it's done by the committee. The committees reach out and do it, but we certainly knew it was happening, and we could have made an announcement out. So thank you for the comment. Okay. If there are no more questions or comments, we can move on. Next up, we're going to do a few minutes. I think we've kind of covered this for the most part, but to go ahead is what's happened since we last met. And mostly it has been about getting the plan finalized. It was drafted. Thank you all for your work. I know it was a rush at the end. For some of you, you felt like you were probably in multiple meetings a week that last month or two to get all the language put together. It was drafted. It was sent out to committee members. We did get feedback back. We've made some adjustments, and the process within the state government of having it reviewed not only by program, but also by communications and legislative staff and so forth, it takes some time. And matter of fact, it's taken more time than what our time frame was. And so we have done all the proper notifications that we have it in by the end of December. And that seems to be acceptable by folks and those in leadership. So I think we're in a good place now. I also want to address another issue, because as we were finalizing the plan and reviewing the legislation and talking back with sponsors and talking with our legislative folks about moving forward and intent on moving forward, we needed to find a way to share what hasn't come through. There was work that was percolating in the committees that didn't come all the way through. We didn't want to lose that, but we also didn't feel that keeping the subcommittees in place, at least for right now, was, I guess, I don't know how to best say this, but we didn't want to set people up to do work that wasn't going to be brought forward in a timely way. So we suspended the committees, and we're going to take the work that the committees hadn't brought forward yet in terms of content and put that in a letter to the legislature. So when they receive the plan, they'll get the plan, and then they'll also understand that there was still much to be talked about in the committees And although the time clock hit and the plan was to be submitted, and that's what the legislation asked us to do, we wanted them to understand there was still much more to be discussed or was being discussed. And so we'll try to encapsulate that properly and transparently to the leadership. So that was a little rocky time. We know that there was energy in the committees, and we appreciated that energy. And in some cases, we felt like we were wearing people out. In other cases, we know there's still more energy to happen. So, but this intent was to create a plan, submit the plan for legislature's consideration during session. And so, again, after consulting with our sponsors and with our own legislative staff, they thought, go forth, let's do the plan, let's do the letter with the things that didn't get all the way through, and then see what happens post-session, how much of this is picked up, and then sort of reevaluate at that time. So that's kind of where we are right now in terms of trying to get the plan completed. We will have time, and we're going to talk to you all about your thoughts about how frequently we meet and the kinds of updates that we want going forward. We are called to meet at least quarterly to give an update on the plan implementation, but also I think the Recovery Navigator program, and we'll probably continue to update you on the others as well. But we could talk about that. I don't know if that's part of this, Michelle. Look real quick. I think that's
I think the
SURSAC.
Yeah, that's coming later to talk about the meetings.
Okay. So I don't want to go too far and get this discombobulated. So for right now, again, the plan is very close. It's in the communications hand, and it will be forwarded over by the end of the month. And really want to thank the co-chairs again, not only for presenting at the Law and Justice Committee, but also all the extra time you put into your work, and acknowledge that in many cases you felt like there's more to have there, and we may get to that. It's just it won't happen before session or for this plan. So, questions, comments, Malika? I don't know if your hand's up from before. Or if you have a new question.
I do have a new question. I just wanted to make super clear that I understood correctly. So all of the work groups have been dissolved. So all the places where the community can be involved in the process have been shut down. I just want to make sure I heard that.
Well, for the plan itself, that's we're putting the final touches on that. What we'll talk about in a moment going forward, Malika, is what do we want our check-ins to look like? How, we have to go at least quarterly. We could go every couple months or something like that and add in a few in the year. And then what do we want those to entail? We know what they have to entail, but what else do we want them to entail? So we can get community feedback from the programs themselves, like where it's working, what's the experience look like, where it's not working, where there's not access, and ask for that feedback. So I think there's some opportunities. We want to talk with you all about that. There may be opportunities you can think of too about how to continue to bring voices forward. And then if there's subcommittees in the future, which there could be, one of the recommendations was to have a committee, I think on the, was it the drug testing, I believe, or
the safe
supply.
Yeah.
Safe supply, yeah. So if there are committees, going forward, that'd be another opportunity. But we don't want to do what in terms of shutting down the voice going forward. But in terms of the plan at this point, yeah, the committees have been suspended. So thank you for asking. Okay. Again, with a lot of gratitude and appreciation, I think we'll go ahead and move on to the reflections and considerations from this past year. And I know while we've had a lot of folks pleased to be able to weigh in and see their thoughts materialize, and at least to the planning step, there are others that have felt like that, yeah, we're here, but we're still not kind of getting what we want. So we want to take an opportunity to kind of reflect back and see what worked and maybe what didn't work as well, and sort of encapsulate that. So Michelle, I'm going to turn this over to you. I think you're going to introduce Missy and go forward. So.
Yeah, thanks, Michael. So Missy Sterling is going to walk us through the use of a tool called Mentimeter, to gather feedback from everyone all at once. It's going to require logging into a website, I believe, right? And then you'll be able to type in your responses. We can see responses coming in. And it will just be a more interactive way of gathering feedback from folks on a few of these questions as we look back at, what happened in 2022 and what we're moving into now as we approach 2023. So with that, hand it over to you, Missy.
Thank you. So on the screen in just a moment are going to be some directions. If you'd like to get logged in through that, you're more than welcome. I'm also going to place a link in the chat. This is a more simple way to join us without having to type in the code. However, if you're on the phone and you're listening and you can't see the screen or access the chat, I'm going to give you verbal directions as well so that you can also participate. So if you have a cellular device that does connect to the internet, you can just minimize the phone call and open up whether that's Safari or Google Chrome. Both work as well. You're going to navigate to menti.com. It is spelled MENTI.com. When you get there, it's going to ask you for a code. The code can be found at the top of my screen. Again, the link is in the chat. I'm also going to type this code in the chat as well. But for those of you listening over the phone, that code is 88605056. Again, that code is 88605056. When you get on that screen and you get logged in, you will see these directions on your screen. If you can tap that heart button for me, just let me know that you've been able to join me successfully before we go ahead and move on to the first set of questions. That will make sure that I don't leave anybody behind. We don't want to do that today. We want to make sure the feedback is gathered. So again, go ahead and navigate to menti.com. You can click the link in the chat. That'll just pull it right on up for you. And we'll go ahead and get started in just a moment, making sure we have the majority of the hearts we should be seeing. Got about 19 now with roughly 68 people on the call, so we'll give it just another minute. If you're experiencing difficulties with this, please either put that in the chat or unmute and let me know and I can give you specific directions. All right, seeing those hearts slow down just a little bit. Michelle, I want to confirm, are we looking for more than 24 individuals voting on this, or I'm sorry, providing feedback on this?
I believe there's 26 members of the SURSAC committee, but not all are present today. So I think about 23 or so. I think we may have the folks that we need based on the number of hearts. Yeah.
Okay, let's go ahead and get to the first question. That first question is, what went well in 2022? This is an open text field, so go ahead and type in your response. If you have more than one thing that went well in 2022 to share, go ahead and submit one at a time. You do have the option to submit more than one answer, so go ahead and type in your answer, hit submit, and then it should repopulate an opportunity for you to submit more than just one. We'll give it a couple minutes here, and as you reply, this is entirely anonymous. So as you reply, you will see others' responses pop up here, which may spark another thing for yourself, so feel free to continue engaging until we move on. What went well in 2022? I will just read a couple of these as they come in, trying not to break any thought processes, of course. Strong interest in improving the system. Important drug policy and practice ideas moved forward. Brought together many excellent experiences. More options for people to get help in the community I live in for substance abuse. Many new voices were brought into the discussion of substance abuse. An expert panel in September to provide input needed to support legal policy decision. Give it a couple minutes to let thoughts continue coming in before we move on. This screen will scroll, so don't feel like you're going to lose room. If you don't have anything to add, that's okay too. We'll give it about another minute and we'll move on to the next question. really great stuff in here in case you're not able to see that on the screen. Challenged the status quo, focus on DEI, group of individuals interested in making changes to improve the current system, consistent membership, people with lived experience having a voice. Alrighty. Looks like responses have slowed. So we'll move on to the next question. Your screen will change with mine, so you need to do nothing. The next question is, what recommendations are you most proud of or excited about in the SURS plan? Again, go ahead and type in your responses. You can submit more than one. What recommendations are you most proud of or excited about in the SURS plan? We see safe supply, hubs, more safe supply. Drug decriminalization, health hubs, housing, definitely MOUD and jail programs, more accessibility to life-changing resources. These are great things to be excited about and proud of. No court fines for drug users, hubs, comprehensive health hubs for people who use drugs. No criminal penalties. And it scrolled on me for personal something, so I'll get back to that in just a second. Education fighting stigma, personal possession. Okay, no criminal penalties for personal possession. Perfect. Give it about another minute, and then we'll move on to the last and final question for this Mentimeter.
And Missy, we're capturing these, right? They don't disappear when we move on. Okay.
Correct.
Yeah.
Wonderful. Alrighty, last and final question. Where do you see room for improvement in 2023? Where are opportunities for improvement here in this next calendar year? Where do you see room for improvement? Again, you can submit more than one response, and your responses are anonymous. You see centering voices of those with lived and living experience. It's an opportunity for improvement. It's great. DEI. Another one for DEI. Like we have some opportunities there, definitely. Hopefully we have much more data and community involvement to work with. Community buy-in, advocating for more widespread acceptance from our community partners, including law enforcement. A real understanding of the plan to decriminalize and how we can jump in to help those clients continue to have lived experience at the table. These issues deserve far more time than we have been able to give them, creating respectful and inclusive policy processes at HCA. We'll give it another minute for any opportunities or where you see room for improvement in 2023. Voices of I feel like I'm here but not heard. More harm reduction policies being put in place, more policies centered on the point of view of lived experience folks, policies that really support safe supply in our state. Bring law enforcement to the table. All right, these are great suggestions, opportunities for improvement in 2023. That's the last question I had for you today. So I'm going to hand it back over to Michelle and stop sharing my screen. Thank you.
Thank you so much, Missy, and everyone that responded. That's so so helpful to see your thoughts and reflections on all of those questions. So the next item agenda is looking at SURSAC in 2023 and discussing a few things about what's coming up, what our new charge is now that the plan has been written, what we're doing in terms of implementation, and as well as deciding things like meeting schedules and stuff like that. So with that, I'll hand it back to you, Michael.
Okay, thank you, Michelle. And thank you, Missy. For those of you that have been here throughout the year, and you know Blake and the support he's been providing to us, and he'll be on here in a little bit as well. He and Missy work together, and so we will often call on Missy to come in and help us out in group settings to kind of get the collective thinking going. So thank you, Missy, for doing that. Yes, as we talked and kind of teased a little bit about SURSAC in 23, one of the first questions is, well, let me do this, kind of background a little bit. We know what our charge is in terms of looking at the plan, meeting quarterly, seeing if there's progress made on the plan. You know, this is heavily dependent on the legislature in some respects. So we'll be watching, particularly in early 2023, to see what's proposed and what may be adopted. But also to get in, to look at the Recovery Navigator program. And as the questions came up earlier, okay, you're in all the counties, but what's happening? How many folks lives are being touched? What system changes are being made? Is law enforcement as a community using the Recovery Navigator program in a ongoing and meaningful way? So there's lots of questions there that we'll be exploring at these quarterly meetings. And I think also, and we'll interested in your input on this, but I think also just the portfolio of responses to Blake we'll want to get an update on and continue to see that host and MOUD and jails and some of these other interventions are working well also, or to the degree that they're what the capacity is. So we know that's what we need to do in the quarterly meetings. But as we were talking internally about, okay, how would we play this out in 23? We really want to get a sense from you all in terms of your time commitment. Would you rather go a little bit more frequently than quarterly? Would you rather go, for example, to maybe every couple months? And that we get 6 meetings in. And then in addition to meeting and kind of having report outs, how might we hear from the community how these interventions are playing out across the state, both those that have been funded and perhaps those that will be funded in the future based on the plan. So we're really got kind of jazzed about the idea of having service recipients, if you will, people, people are getting services and maybe their families come in and talk about how accessible and how beneficial the services were. Or not, things are working wonderfully in Yelm and Rainier and Tenino, Washington, but we can't get anything up in Olympia, Tumwater, and Lacey. I don't know. I'm just making that up, but we kind of want to get a reality check, I guess, at these check-ins on what's working well and what's not. So the question, and we should have probably left the Minty on here, but we'll do raise a hand or some way of getting your input. But if that's the idea in terms of what the intent is this next year, tracking the plan, getting input from the community on how things are working, looking at Recovery Navigator program. How often would you guys like to meet? Does quarterly sound right? Or would you like to meet a little bit more frequently than that? And, I don't know that we'll do these day-long marathons that led up to the plan itself, but we're thinking 2 or 3 hours, if that seems reasonable. I'm going to stop talking and just kind of try to get a pulse of the group about the frequency and see what you all might think on that. So let's just start off. Let's go between every 2 months and quarterly and kind of get your impressions there. If you want to go ahead and put in chat or raise your hand, you can call on you. Sarah, it looks like your hand might be raised up first.
Yeah, I just want to center what Caleb's saying. I feel the same way. If we could get a little bit more clarity on kind of what the goal is over the next, well, I know that SURSAC is approved for 6 years, I think, but so if we can get some short-term and long-term idea of goals, then it might make more sense to vote on how often we're meeting.
Okay. Fair enough. I think Michelle, you put up the language here, at least the legislative language. The authority must submit a report on the implementation of SURSAC to the appropriate members by December 1st. Okay, we already know that. And then each Recovery Navigator program must submit quarterly reports. Is this the one?
This is just to outline the two main objectives of the implementation and moving forward 2023 and beyond. So that these are the two things that we need to be doing within the committee from now on.
Okay, I might be just reading right over it, Michelle, but I thought it said we meet at least quarterly. Does that say it here somewhere?
We need to provide the quarterly reports from RNP, and so to review those and discuss them, a quarterly cadence makes sense, right? Yeah.
Okay, I got you. Thank you. I thought it actually said quarterly, but it doesn't. It just says the Recovery Navigator reports. And then depending on what comes out of the legislature, we need to adopt rules and contracts post-legislative sessions. So, all right, so I want to come back to this and not shine over it. So, Caleb, you're asking what is expected of the SURSAC committee. So, one thing is to look at the quarterly reports coming from the Recovery Navigator. We think we could do much more than that, but that's one thing that we need to do. And then we also want to provide an update on the plan itself in terms of, are any of the ideas being adopted? Are they being picked up either through the legislative process or federal grants or other mechanisms to carry them forward? So we knew we wanted to do that. And we also felt it would be important to get impressions on how the investments being made as a result of the Blake decision, how they're playing out. So basically updating in more depth the work that Tony shared with us earlier, and actually bring in the voice from the community and get the impressions of how things are working out or not working out. So I don't know if that's enough detail, Caleb. It's not a 12-point plan, but that's at least where we're starting from. And it looks like there's a hand up. Malika.
So it just feels really frustrating a year in to not have a better grasp on what we were supposed to be doing with this particular group. Ideally, this interdisciplinary group was the vision was that it would function somewhat like a PCG, like a policy coordination group. Like we would have a group of multidisciplinary people that could be working together, building consensus, understanding the issues to put forward solid recommendations, and also review what was happening with all the work that was a part of 5476. And I don't hear that being expressed as like the potential for our duties. The data system that is being used to measure that success isn't going to give us good information, in my opinion, to be able to make some of the decisions that this group will be voting on. So I'm just hoping that this group can be that interdisciplinary group that is going to be teaching each other, learning from each other, working together. And that's where, to me, where solid policy comes from, not some of the willy-nilly votes that we have engaged in as a part of the, and I know willy-nilly is not an actual like professional term, but that just is what it feels like. And as a person who's engaged in this process. So I'm hoping that we can get to that place of deeper learning. We did all of that at the very end of this process when it felt like we should have been, our charge was to be doing it throughout the whole year. So I'm hoping going forward that we can continue to grow and learn, not just from what's happening out in the field, but what we aspire to have happen and bring that knowledge into our communities.
Okay, thank you, Malika. You probably said it more eloquently, but I'm not sure we're too far off in wanting to track the work of 5476 and bring forward the what's happening and maybe what could happen. And maybe that's the part I didn't get that you did bring forward. So thank you. Other thoughts or comments, questions? Okay, I'm going to come back and ask whether or not you need a little more detail before we decide on the frequency. I've seen some things in chat, although like Tony, it's a little difficult to catch both at the same time. Hey, James is looking every 2 months. Sherry says every 2 months perhaps would be best. So why don't we do this if we don't have, oh wait just a minute. Back to people. Malika, I see your hand up again. Is that from before or is that new? Okay, it's down. All right, why don't we do this so we can move off the big vote of how often. Why don't we do that for those members that would like us to go into 2023 meeting once every 2 months? If you could raise your hands now, and we'll just do a vote and see if we have general direction here. So every 2 months, I see Sherry hand up. Brandy, go ahead and put your hands up if you want to do every 2 months. And the other option is going to be quarterly, just so you know. So.
Did you say our only two options are 2 months or quarterly?
That's where we were starting, Malika. If you have another idea, feel free to share that.
Multiple people said that monthly is a frequency if we're going to do work, like what we're charged with. That's what was in the chat.
Okay. So, Michelle, did you get that?
Yeah. So far it sounds like we have three options. Keep your hands up for every 2 months right now. That's where we're starting. Then we'll do quarterly. Then we'll do
No, Michelle, let's not do that. Let's start all over. I didn't see in the chat that there was some interest in meeting monthly, and so we can make the choice of monthly or every 2 months or quarterly. Again, we won't have information. We're not going to have data, at least on the RMP. We'll get that quarterly. And for the first couple months, there won't be a lot of information coming in, but we could, let's just live to the group and see how often they'll do. So let's do monthly, every 2 months, or every 3 months, once a quarter. And we'll start, let's just start with monthly and then work up to quarterly and see where there's interest. So if you would like to meet every month, feel free to put your hands up, please, if you're a member. And this is monthly. And it looks like there's $10. I'm looking at Michelle. I don't know.
Sorry,
11
Wanda, I'm
maybe?
going to put your hand down. This is for SURSAC members only, this vote.
Okay. So we have 12 for, I'm seeing 12 now, 11.
12
I don't
monthly.
know.
Okay.
Michelle, for monthly. Let's go ahead and do every 2 months. You want to meet every 2 months? Yeah. Like we have 4 hands up. If folks put theirs down before, it looks like we've got, now they're disappearing. So if you want to meet every 2 months, it looks like we have 1 hand up. Is that right? Okay, or 2 hands up. Chad's in now.
Okay.
So 2 for every 2 months. And then quarterly? Any folks want to meet on a quarterly basis? All right. So it looks like pretty overwhelming. Folks like to continue to get together monthly. And so we'll think about the agendas on a monthly basis. And let's see. Okay. So that may be it. in terms of starting, trying to think when the best month is to start this. If we do it in January or do it in February, we may have a better understanding of where things are at in February. Okay. Well, let me ask the group. Does February sound okay to folks? We will have some sense. We won't be through session yet. We'll have some sense of what might be put out in a bill form, I guess, at that point. Sherry, your hand is up. Do you have a question?
No, I was agreeing to February. I jumped the gun.
All right.
Sorry.
Okay. Malika may be doing the same thing. I'm not sure. Malika, your hand's up too. Were you just responding to my question?
No, not to the February portion of it. I was just going to say, I'd like to uplift that, this isn't just about responding to what HCA gives us, that we're providing our own guidance and suggestions and that we're working together in collaboration. So I don't feel like it should be completely dependent upon exactly what the data that we're going to be looking at, which some might say is not super related to the charge. Anyway, and also like what the legislature is doing. I mean, like this is work that needs to continue to move forward, period. So I'm going to say January, and I didn't raise my hand to say that. I didn't know if we were going to vote later, but I just think that we need to be thinking about this more holistically. But if y'all choose February, then, you're the ones with the power.
Where you going?
Okay.
Good boy.
All right. Well, we certainly want to have meaningful agendas and give people opportunity to share. So we can go ahead and look at, I'm sorry, I'm stumbling here a little bit because I'm thinking how much time we have to collectively put together an agenda, and knowing that we've got a lot of folks that are going to be out here the next, probably including members are going to be out here the next couple of weeks. So let's go ahead and see. If folks would like to choose January or February, let's go ahead and get the impressions of the group, and that may tell us where we're heading out to. So if you would prefer to meet in January, we'll make the choice between January and February. If you prefer to meet in January, please raise your hands at this point.
Sorry, Deontay, I'm going to lower your hand. It's a SURSAC member vote right now.
Okay. I'm seeing 8 for January. Can we go ahead and vote for February as well?
So that was 8 for January?
That was my count.
That's what I saw.
Okay.
Okay. So now we're voting for February, and we have 4. So we have had 12 people vote. So I'm not sure we got everybody's weighing in on this.
Yeah.
Okay. Well, let's assume that if you wanted to vote, you voted. If you felt like you got confused there, please raise your hand. I'd rather get things clarified now. So Sherry, I see your hands up. Do you have a question or comment?
No, just starting in February again.
Okay. All right. Well, it looks like of those that voted, most would like to work in to come together in January. So that's what we're hearing. And okay, so the other comment was about the posting of the agenda and doing that ahead of time, at least a week ahead of time. And so we'll strive to do that. That's a little easier than, quite honestly, when we thought we were coming in at 2 or 3 months, that we would be able to do that pretty easily. Monthly gets a little more challenging, but we will make that a goal to do. It's respectful for those that are participating. So thank you all. And I think at this point, Michelle, did we have any other comment to make there?
I think the final thing was to have invite some input about the DEI, what we want to do in terms of public comment and bringing folks on in 2023. But yeah, if we haven't.
Okay, I thought we addressed that with the, but maybe we didn't. We talked about having the voices come in from the community and so forth at the meeting. So let me pause here for a moment. I think that Dr. Patinos would like to say a word. Teresa, if you're on.
Yeah, I am. Thanks. And
yeah,
I will apologize for speaking out of turn here, Michael. I'm just trying to, I wonder if listening to the conversation, and I don't know if HCA can manage this, but one thought I have, it's pretty clear from the conversation that you all want to keep meeting, and whether or not it's in fact true that HCA, we're a barrier or in your minds a challenge, which I understand. I wonder if going forward, we have our responsibility, which is required by law, which Michelle shared with you in the slide. So we have to do that. If the committee wants to meet, why don't the subcommittee chairs develop the agenda, figure out who they want to invite? HCA can help facilitate that. We can post agendas. We can see if we can support taking notes. We can make recommendations from a state perspective or a Medicaid perspective or whatever, how some of what you put forward may be moved forward. But you're not going to be, the committee's needs aren't going to be met the way you want them to in the format that is there now. And I'm offering HCA to do work that I haven't asked permission to offer. We want to be helpful, but a large part of this isn't just our work. So Michael, I apologize. I just thought of this as I was listening. But I just, committee clearly wants more ownership.
Okay. Well,
and I just put Michael on the spot. Everybody just please know, I just threw a huge pile at Michael without even giving him a heads up. So Michael, if you need to think about it, that's fine. But I'm just reflecting what I'm hearing from the group.
Okay. Thank you, Teresa. And I will give that a little bit of thought. We definitely want this to be committee driven. I mean, we want folks to feel like they have voice and they're being heard and that they're putting forth their best ideas. We do have some staffing capacity to think about, but we thought that we were coming and going quarterly, and we thought, oh no, we can go every 2 months. We will certainly give great thought to the desire to meet monthly. I think it's just quicker hits, right? If you go monthly as opposed to every 2 months or every 3 months, but maybe it's that cadence and that continued conversation that's important. So we'll definitely take that into consideration. And then how we build the agenda, I think, Teresa, maybe something of what you're getting to too, is that how do we hear the voices about what needs to go on the agenda? We know what we need to do in terms of updating the program, projects, and tracking the plan, but there may be more there too. So certainly open to talking about that. Okay. All right. We do want to honor our public input time as well. And so Blake, I'm going to call upon you to step in. For those of you that have not been on, Blake Ellison has been a great asset for us this last year, coming in and helping facilitate the meetings and keeping us pointed towards the goal of the plan. So thank you, Blake. And he also helps facilitate our public comment period. So Blake, I'm going to have you go ahead and join us and welcome you here this afternoon, or this morning. We're still in the morning. So
yeah, we are. All right. Thanks, Michael. So now it's time for public comments. Just a reminder for folks that this is for non-SURSAC members. So anybody from the public that wants to make a comment, You can raise your hand if you would. In the chat, we'll call on you and you'll have 3 minutes to speak. So first call for public comment.
Blake, this
I
is
see.
Lisa Dugard. I'm on the phone. I can't raise my hand, but
Okay.
I can go in the queue.
Yeah, I got you, Lisa. Let's go with Mark. And then Lisa, and then Deonte. Go ahead, Mark.
Hi, good morning. Can you hear me okay?
You're a little soft, but we can hear you.
Okay, I'll try to speak up.
That's better. That's better. Yep.
Two quick points. And the first one is just huge thanks to everybody involved with the SURSAC committee, particularly people with their own lived experiences. It's hard work. It hasn't been perfect, but, I think everybody deserves thanks for sticking with this. And I'm really encouraged that people want to keep working. And I hope Healthcare Authority has really taken that to heart today and to let this important conversation keep happening. I think it would be a real mistake if this kind of just became, something that gets swept under the rug at this point as the legislative session moves forward. So I really hope that you engage and try to improve this committee and keep it going forward. And that, as the legislative debates start, I hope that SURSAC committee members are out there talking about the recommendations, which I think really were strong ones and come from evidence and they come from lived experience, and people shouldn't be afraid to talk about them. And I hope they're invited to those conversations to lawmakers and staff that are part of this. My second point is, I think we're hearing lots of stories between Washington and Oregon about, oh, everything's been a failure since some of these laws have changed in the last couple of years. And I think that's just incredibly disingenuous. It's hard work to change systems, right? And especially in the midst of a global pandemic. And I really hope that people give some grace and some time to trying to change these systems and having a full-fledged conversation about, what's happening, what needs to be changed. But the truth is, the real failure has been the war on drugs, right? And so these comments that we just need to go back and criminalize and coerce people, and that's going to fix things, are really disheartening to hear. We have decades and decades of experience of how treating substance use disorder as a crime has harmed people, how it's been waged in a truly racist way. And so I hope that anybody that is engaged in these conversations about how do we deal with these really difficult subjects are also putting the war on drugs under the microscope as well, right? Not to say that, things have been easy in terms of implementing new programs, but we need to have that more robust conversation. With that, I hope people are really proud of the SURSA recommendations that came out and are going to listen to them. And I really hope our lawmakers are paying attention and are going to fully invest in the alternatives that are needed to really address these issues, and that we don't go backwards and just rely on police and prosecutors to deal with this public health issue. Thank you.
Thank you, Mark. Appreciate the comment. Lisa.
Thank you. Apologize for trying to do this on the phone. I guess the comment that I want to make is about despite so much for people who are struggling with substance use issues and related issues, why is there this sentiment that it's not working? And this is just like hard-won wisdom, so take it if it lands for you. The war on drugs is a failure, and almost everyone in our country thinks that. However, when it was the status quo, it's easy for people to point to everything wrong and put it at the feet of the war on drugs, usually appropriately. Once that legal framework is set aside, even in part, as happened with the Blake decision and with the mandatory diversion framework of 5476, the compromise that pleased no one, effectively, those of us who are critics of the war on drugs, we own the status quo now, even though we don't actually have control of any of the levers of change that that we need, or almost none. And that's the problem, is that people don't look back, like, oh, 2 years ago it was terrible, it was even worse. People don't look back. People look out their door. People know that their kids are dying, that their stores are being broken into, that their catalytic converters are being stolen, and they rightly conclude that things are a giant mess and that no one is coming. And they are correct, y'all. And we have to like not be afraid of that truth. We have to wrap around that and be like, you are so right. And that is nowhere more true than with law enforcement. Honestly, law enforcement got told they can see terrible things. Their hands are tied. They can't do anything. They basically have to divert to nothing still in most areas of the state. And that has just built up a sense that the rest of us don't understand how bad it is. So we just need to, you know, I think deeply appreciate that building where there's nothing more important right now. Our list of recommendations on the health side are fantastic. And if we weren't living with a multi-decade legacy of criminalization, they would probably, you know, have a good on-ramp and everything would go well over, you know, as the years roll by. The problem is we are still under and are likely to continue under a legal prohibition framework. And because of that, we have to gain the good faith, willing agreement and partnership of people who have the ability to arrest in prison people who use drugs, not necessarily for possession, but for all the ancillary stuff that goes along with the use of drugs problematically in our current society. So we have to pay attention to that half of the conversation to like 10 times more than we have if we want to keep moving down this road. And we're at the Lead Bureau, we're all in for that. We are here for you to do that with you. And we definitely think it can be done, but it has to be done.
All right. Thank you, Lisa. Appreciate that. Michelle.
I'm Shelley Wilder. I'm signed in under my school account, so it's a different name. I just wanted to point out that, again, it was when DEI was brought up by Michelle, it was where I thought a conversation about what we're going to do in 2023 about DEI was going to happen. It was shut down and said, oh, we already discussed that. We're bringing people in. That's exactly what multiple people said in multiple meetings. That is not a successful way to get their input. And we need to go to people and we can't ask people to come to a meeting at your convenience and call that DEI. And I would have loved to hear this diverse committee's opinion on what they wanted to have for DEI coming in 2023. And I really loved Chris's idea of HCA stepping out of the way and maybe just facilitating and giving the SURSAC committee control over the agenda and how this meeting is going forward. So I want to uplift that idea and just say, again, cherry picking stories, success stories to come and talk to committee members about what is going well in your eyes is not how you do DEI, and get the views of people with lived experience and how it is working on the streets around the state. So I would appreciate it if we tried a different route. Thank you.
Thank you, Michelle. Appreciate the comment. I don't see any more hands up. Deontay, hand was up.
Well, pretty much everyone brought it home, and hope everyone had a holiday week. But I mean, it's just really just important just for everyone to know why we are here. And when community members with lived experience come in the room, let's also just be mindful that they are the conversation. So meaning that there's a lot that we can learn from them. So I mean, I just want to just hope that we're continuing to push the inclusion part of that. And I mean, HCA has done a great job with listening, but I think we just need to be more actionary next year with making sure that we're putting them to the forefront of this conversation. Bless you. Bless you, Brandy. I see you sneeze, girl.
Thanks, Deontay. Appreciate that. All right, don't see any more hands. Last call. Public comment here. Okay, Michelle, I'll kick it back to you. Thank you.
Great, thanks, Blake. Michael, it looks like you want to say something though. Do you want to go ahead?
Yeah.
No, I was gonna just suggest that maybe that is January. That we talk about not only DEI but inclusion and engagement and such. So that could be our conversation. The items that we had talked about in terms of having folks come in from the community was the part that when Michelle said, "Did we talk about that?" I said, "Yeah, we did." But certainly we could have a more thorough conversation about what that looks like for 2023. Please, I would enjoy that. So. Well, anyway, that's all I was going to respond to, Michelle, on that front.
Okay,
So we have
great.
a lot to think about when we go back. So.
Yeah. And so there was a lot of information shared at today's meeting. As Tony mentioned before, I'll get those slides out. I've also received some other materials from folks over email just now that can be sent out to the committee members in terms of the stories that were requested from Don Julian, and then there was someone had asked for the pamphlet and whatnot. So as much of those things that we can get out to you, we will do that shortly after the meeting as part of meeting notes, and then there will be the responses from the mentee as well. And I'll get started scheduling those monthly meetings for us.
Hold on one second, because I hope that I just wanted to say one last thing. Sorry, y'all. And when I was saying when I was saying that you guys were listening, that means is that you were inviting community members to the table, but can do a better job with actively listening with action. I just wanted to just make sure that was clear. That's not to take away why that the table is being set, but just know that we just need people with lived experience to continue to help build that table. I can't act like I haven't been frustrated through some of this process, but I know that is for us. There's a greater good that can come, and we can't do that without lived experience community members. That's all I have. Thank you.
Thank you, Deontay. All right, I think that's it for today. Unless you had any closing remarks.
Hey, Michelle, real quick.
Yeah.
Hunter had a question in the chat about the follow-up regarding those 3 questions. Not sure if is that going to be sent out in a summary document?
Oh, right. Yes. Yes. So all those responses that we collected, those are saved. Those will be in the meeting notes. And we'll be reviewing those, and if there is any kind of follow-up or action to take from those, we'll be doing that in the January meeting. But mostly that was just to get a sense of where people were at with 2022, and certainly with what you'd like to see in 2023, that will be carried forward into the conversations in the future. So yeah, great question, Hunter. Thank you.
All right. Thank you, Michelle, and everyone. Appreciate your comments today and your frankness into responding to the questions. And for our new members, I look forward to seeing you in January. Hope you come back. I appreciate you providing comments today. So thanks, everybody. Take care.
Thank you.